Okay. Hi, everyone. I would like to start by thanking the organizers of this virtual event, the edition of Europe Global Conference on Pediatrics and Neonatology, for the opportunity to share our research with you. Let me introduce myself. My name is Marlene Escobedo Monge, and I studied in Lima, Peru, at the Faculty of Medicine of the National University of San Marcos. And nowadays, I work as a pediatric researcher at the Valladolid University in Spain. But I'd like to present our results on effects of zinc sulfate and nutritional status in children with chronic kidney disease. If you have any questions, I like to answer them at the end of this presentation. In my presentation, I'll focus on three main issues. To begin, I'll give an overview of chronic kidney disease in the context of chronic diseases in childhood. After that, a brief description of the zinc status in human beings, and finally, I outline what the study consisted of. But before starting, I would like to focus on this pandemic situation. We need to refer all support for COVID-19 vaccination for children and adolescents living with chronic diseases around the world. Today's topic is of particular interest to those of you who share our goal of improving the quality of life for people, especially children with chronic diseases like a chronic kidney disease. Diseases can be divided into short-term and long-term conditions. By definition, a chronic disease is a long-term, non-curable condition that, with a minor evolution over time, are from the beginning, by definition, chronic. For example, cystic fibrosis. Now, ask yourself, how many children and adolescents living with chronic diseases? Thanks to advances in medicine and improvement in public health services, more than 90% of children with chronic diseases or disabilities survive beyond the second decade. In 2017, the overall prevalence of chronic condition in childhood and adolescence is estimated between 15 and 20%. Some of these conditions require daily and lifelong medical treatment. It's important to take into account that the number of chronic diseases in childhood, we must add the chronic conditions that appear in adulthood. These chronic diseases can appear at a younger age and be more severe. For example, overweight or obese children are not likely to remain obese into adulthood and to develop non-communicable diseases such as diabetes, cardiovascular, or even cancer in younger age. This fact is especially important for chronic diseases like a chronic kidney disease. As you all well know, chronic kidney disease is increasingly as a global public health concern and an important contributor to morbidity and mortality. Chronic kidney disease had unique characteristics and issues, such as the impact of the disease on growth and development. Low retardation can occur in up to 35% of these population before the onset of end-stage renal disease. But it's important to remember is that although chronic kidney disease is more common in adults than in children, it's a chronic disease with severe long-term consequences and require nutritional support according to their nutritional status, that is, malnourished, normal, overweight, or obese. Nutritional status and kidney function are closely associated with effects like expectancy. From the nutritional point of view, adequate nutrition and periodic evaluation are key components to prevent the development of protein energy malnutrition and meet the patient's vitamin and mineral needs. Malnutrition, metabolic acidosis, mineral and bone disorders, anemia, and fluid and electrolyte abnormalities are risk factors that contribute to impaired growth. Good nutritional status is a fundamental factor in the control of this chronic disease. Essential factor in nutritional status in children with chronic kidney could be the status of zinc. Zinc is recognized as essential macronutrient for all life forms and is an essential macronutrient for human development. In this slide, you can see some image of acrodermatitis enteropathic. It's a severe manifestation of zinc deficiency. The absence of zinc in the diet causes the human body to be unable to continue proper growth and development. Get sick more times, and the time of illness is prolonged. During the development of the child to adulthood, zinc deficiency is seen in the duration of infection as common as diarrhea, pneumonia, and malaria in developing countries. Likewise, in developed countries, zinc deficiency also appears in populations with deficient zinc intake and or with some type of long-standing disease where zinc deficiency is the result of an inadequate balance between income and losses. Inadequate dietary intake of absorbable zinc is one of the main causes of zinc deficiency. In chronic kidney disease, the main cause could be the increase of losses during, by urine. Zinc in the human body is dependent on zinc in solutes. Now, what can we do? As you all well know, there are few studies of zinc deficiency in children with chronic kidney disease. Therefore, the main aim of this research was evaluate the effect of 2 doses of zinc supplements on the nutritional status of children with chronic kidney disease. This research was carried out in Lima, Peru, in 3 care institutions, reference centers for these patients throughout the country. in the Pediatrics Nephrology Service of the National Institute of Child Health, in the Social Security of Health at Valladolid University Hospital and the Metropolitan Hemodialysis Center. Translated into grand terms, our research was a clinical trial in a series of children and adolescents with chronic kidney disease. That is, it was a multi-center, simple blind essay. In this slide, you can see the inclusion and exclusion criteria. This randomized trial was designed in two phases. The first phase of 2 months was washout period, and we performed the diagnosis of baseline nutritional status. In the second phase of 12 months, children were randomized into groups who received zinc sulfate supplementation per day. Group A took 30 milligrams, that is 6.8 milligrams of elemental zinc, and Group B took 15 milligrams, that is 3.4 milligrams of elemental zinc. Monthly, we perform anthropometric assessment, and before and after therapy, we carry out biochemical analysis. Regarding anthropometric assessment, we evaluate weight, head, neck and circumference, and triceps skin fold thickness. We use the Sancho and Orbegoso table as references for weight for age, height for age, weight for height, nutritional index, body mass index for age and for height, mean and muscle area, fat-free mass, and fat mass. The cutoff was, less -2 standard deviation score. The growth rate was calculated using medical reports. In this slide, you can see the cutoff used for serum albumin, C-reactive protein, and serum zinc. This study, in addition, in this study, we have 2 endpoints. The primary endpoint was obtained 10% difference between the 2 groups from baseline to 12 months in nutritional indicators. The secondary endpoint was the significant change, that is positive or negative, in patients' anthropometrics and biochemical indicators. Okay. In our study, 48 patients took part. 48 were women. Mean age was 13 years old. 23 were children and 25 adolescents. 69% were in hemodialysis, 10% in peritoneal dialysis, and 21% in conservative treatment. Regards nutritional status, 83% were in stunted growth, 77% in underweight, and 10% in undernutrition by low body mass index. The main cause of chronic kidney disease were glomerulonephritis, obstructive uropathy, chronic interstitial nephritis, and unknown cause. We need to specify that in this study, participants in hemodialysis were the only ones who complete 2 blood samples. Our results show that mean serum albumin and zinc were normal before and after zinc therapy. Males have a higher amount of serum zinc than females, but these differences was not significant. C-reactive protein decreased after zinc supplementation. That means that there was a significant change in nutritional status. It's important to recognize that our study showed that there was more than 40% of children with hypocalcemia before and after zinc therapy. Linear regression analysis showed that serum zinc and serum albumin had a significant relationship before and zinc supplementation. Albumin is an important zinc transporter in the human body. In this slide, you can see the difference between percentage of cases with positive and or negative change by group of zinc supplementation. That means our result showed that there was a dosage effect. Dosage effect was small but positive and significant changes in their body mass index. There were more patients with positive change in body mass index, C-reactive protein, and serum zinc and albumin in group A compared to group B. Another important observation in this study that was a little girl that she started this study and she couldn't walk, but after therapy we observed that she could walk by herself. It's important to remember that in this study, children with chronic kidney disease have a high risk of continuing zinc deficient state because more than 40% of them had hypocalcemia despite zinc supplementation. In addition, these children suffer from chronic malnutrition with stunted growth, hypoalbuminemia, and inflammation. These health conditions could keep them in a state of high risk of zinc deficiency if proper control and supplementation of these important micronutrients is not carried out. In conclusion, mean serum zinc was normal before and after zinc therapy, and there was a positive significant association between serum zinc and albumin before and after therapy. Zinc supplementation may be beneficial for nutritional status in children and adolescents with chronic kidney disease, since participants may have improved their nutritional status through the slight but significant gain in their body mass, especially with 30 milligrams per day of zinc. It's important to continue studying zinc deficiency, not only in children with chronic kidney disease, but in all those with chronic diseases. This is the group of professionals who work in this research.